if we are sincere about representing the needs of ordinary Americans, then this is what we must do. We must pass a single-payer national health care program which will guarantee health care for all Americans. How has it happened that the U.S. today remains the only industrialized nation on earth that does not have a national health care system guaranteeing health care to all people? And I'll tell you how it has happened. It has happened not because of a debate over health care. It's a debate over economics. It's a debate over the insurance companies, the pharmaceutical companies, the medical equipment suppliers who are making billions and billions of dollars off of human misery. What happens if you're 70 and you're diagnosed with cancer and you don't have health insurance? Everybody knows the end of the story. You die. Well, that's the way life goes because we're all in it for ourselves. We don't believe the government should provide health insurance to all people. So if I'm a multi-millionaire and I get sick or my kids get sick, I've got the best health care in the world. But if I'm struggling middle-class person, working-class person, lower-income people, hey, government should not be involved in those areas. I know that some of the insurance companies will be putting ads on television telling all of the horror stories about Canada and England. But let's talk about one other horror story we don't talk about enough in this country. According to the Institute of Medicine, close to 20,000 Americans die, D-I-E, every single year. And you know why they die every single year? Because they don't have access to a doctor on a regular basis. Every person here has heard that horror story, talking to physicians who said to a patient, why didn't you come in to me earlier? You are now very, very sick. And they lose those patients, or those patients run up huge bills in a hospital because they don't have access to a doctor. Is that what the United States of America is about? It has been estimated that a full battery of tests for the coronavirus cost over $1,300. In America today, 40% of our people don't have $400 in the bank to pay for an emergency expense. And while the Trump administration says it may cover copays to cover the cost of testing, they will not cover the cost of treatment, which could cost tens of thousands of dollars. How cruel is that? How absurd is that? To say to people, well, we're sorry you have the coronavirus. We actually covered the cost of the test, but now you're on your own. And it's going to cost you tens of thousands of dollars to get treated. That is totally absurd. The strengths of a Medicare for All program are not only its universality and its cost effectiveness. It also ends the complexity of a system which adds enormous stress at a time when people need it the least.